state leaders have resisted the expansion of the federal Medicaid program that is there to help people who do not have insurance. In the meantime, both Louisiana and Arkansas have decided to take the federal money to assist people in their states. According to the Kaiser Family Foundation in 2017, 384,000 Mississippi residents do not have health insurance. Knowing that other conservative states in the country have adopted a version of Medicaid expansion. Mr. Waller, this first question is for you. Would you consider a proposal that would take federal dollars to help insure Mississippians? 60 seconds.
Gerald, we have to do it. And I want to use the Mike Pence reform. We could add, bring up the level to 138% of the poverty level. It will cost zero state budget money, zero state budget. The hospitals are willing to underwrite it because they've been downgraded by Moody's. They've lost over $600 million in uncompensated emergency room care. It would be conservative principles. Right now, if somebody's on welfare, if they get a job at McDonald's, they lose their benefits. That's not conservative. We need to incentivize people to work. Our workforce participation in Mississippi is 49th or the next to last. It's only 55%. I want to get people in the workforce. That's how we're going to create money. That's how we're going to grow our economy. And we have to do it. We're worth $1 billion a year to our 115 hospitals and over 60,000 employees. But more importantly, medical care for our citizens, which I think is a right-to-life issue.
Thank you, Mr. Waller. Mr. Reeves, would you consider a proposal that would take federal dollars to help insure Mississippians? You have 60 seconds.
Thank you, Gerald. I'm opposed to Obamacare expansion in Mississippi. I don't care what you call it. I am opposed to Obamacare expansion. I'm philosophically opposed to adding 300,000 more people to the Medicaid rolls, but I'm not just opposed to this for philosophical reasons. I've studied it, I've looked at it, and I'm opposed to it from a policy perspective as well. I'm glad that you mentioned Louisiana because, you know, there was a study that came out just last week. And did you know that in Louisiana, somewhere between by the way, they didn't expand Medicaid until they elected a Democrat governor in 2015. But this most recent study shows that somewhere between 3,000 and 5,000 Louisiana residents every single month are getting their private insurance dropped and going onto the Medicaid program. In other words, what that has done is it is moving people that are currently insured in the private sector and moving them to the government rolls. That's bad policy. And by the way, that's bad for everybody that has private insurance as well, because your premiums are going to go up if Obamacare is expanded in Mississippi.
Thank you, Mr. Reeves.
Thank you.
Mr. Foster, would you consider a proposal that would take federal dollars to help insure Mississippians? 60 seconds.
I'm willing to talk about all options and put them all on the table, because the reality of the situation is, and I understand this running a small business and working with a lot of different people with a lot of different backgrounds, is there's a lot of families out there hurting in our state, and the federal government caused this problem with Obamacare and with Medicaid. They ruined our healthcare system, and I'm 100% opposed to Obamacare. But the law is the law, and the ACA is the law of the land, and we have to be business smart in Mississippi and do what's best for Mississippians. We have all of these working people in Mississippi that are struggling, and it's hard for somebody like the Lieutenant Governor to understand this, because he's been on the government rolls the last 16 years of his life and had everything handed to him by the taxpayers of Mississippi. But the people that are paying every month taxes and they can't afford private insurance and they have to choose between their own home mortgage and private insurance and they don't have money for both are ending up in the emergency room, and they're getting hit with a bill that wipes their families out and it's bankrupting our hospitals, and we have to come up with a more conservative option than just doing the same old, same old.
Mr. Reeves, 15 seconds to follow that up.
Yeah, thank you very much. You know, the way in which the question was asked and the way the conversation has gone is just about, would we accept federal money? The point that is being missed in all of this is, while there is some federal money attached to it, by the way, I pay federal taxes as well, and the fact of the matter is nobody at the federal government is actually paying for the Affordable Care Act. It's actually being paid for by China because the federal government's borrowing money so that our kids and our grandkids can pay for it. But more importantly than that, it's going to cost the state of Mississippi $220 million per year just in state match if we expand Obamacare.
Thank you, Mr. Reeves.
May I follow up with that?
We're going to get to some follow-up questions, beginning with this. Arkansas has their Medicaid program requiring people to work. Would you support something similar to that, requiring people to work in order to get Medicaid coverage?
Absolutely, but the category of people that this affects are working people. and they also would be required to do conservative things like pay a policy payment and pay co-pays. And the models are there. We're following Mike Pence, Vice President Mike Pence in Indiana. And there is no cost to the state. The hospitals have agreed to underwrite it, and that with what the participants pay will fund the program. It's like a federal income tax refund that we're not taking. That's exactly, we paid the taxes, we're entitled to it.
Thank you, Mr. Waller. Mr. Reeves, is it no under any circumstances, or would you support something where requiring people to work?
When someone says that Obamacare expansion is going to be no cost to the state, I am reminded of what President Obama said to get it passed. He said, if you want to keep your doctor, you can keep your doctor. He said, if you want to keep your plan, you can keep your plan. Well, both of those things have been proven to be false, and I do not believe that it would be no cost to the state. That's a fairy tale belief.
30 seconds, Mr. Waller. Would you support something similar to Arkansas Works, requiring people, Mr. Foster, requiring people to work in order to get coverage?
I'm still considering all options. We have to put all options on the table. We have to negotiate. We have to come up with the most conservative option for the state of Mississippi that makes sense for us with our demographics and with all of the poverty that we have in our state. We can't continue to do what we're doing because all of our hospitals are going bankrupt and families are suffering around our state. It's not conservative when you have to bail out the hospitals with taxpayers' dollars either. So what we're doing is not conservative at all. It's the least conservative option out there. We're bankrupting our entire economy around our healthcare system. We have to come up with something better, and I'm considering all options.
Thank you, gentlemen. The next question comes from Byron.